foundation. So I just want to get the slides to move. Tech support, can we move the slide on, please? It's not moving. And I can't go to the next slide. Thank you. Or you can share the slides. Okay. One moment, sorry. We have pre-tested everything, but as always, there are little glitches with the tech. Thank you. I think I've lost the Wi-Fi as well. Booted me out, it's not my fault. Okay, thank you so much.
It's connected.
Thank you. Sainey had just established Safe Haven Foundation, the Gambia's first and clearly much needed non-profit organization supporting women and men affected by infertility. And in 2017, through the foundation, Sainey organized and led a major fertility awareness campaign, which Suzanne and over 350 Gambian women and men attended. Suzanne and I began an interdisciplinary collaboration on infertility research alongside Sainey and Safe Haven and several other key partners in the Gambia. We led various studies, engaging many students and colleagues from around the world, including West, East, and Southern Africa, Europe, Asia, Australia, and the Americas. And Sainey was always available to meet them, either in person here in the Gambia or online, and to support their work. She welcomed everyone warmly, offered deep contextual guidance, openly shared her lived experience of infertility and connected us all to Gambian communities, stakeholders, policymakers, and the media. In the Gambia, Sainey seemed to know everyone, and everyone loved Sainey. Sainey is acknowledged, Sainey is acknowledged and thanked in numerous master's and PhD dissertations, seen here in the highlights, to express their gratitude. And she is a co-author and contributor in several academic articles. More importantly, Sainey humanized our research. She kept the scientific research grounded, real, and accountable to lived experiences in the Gambia. Now, I was constantly in awe of her courage, her generosity, and the way in which she used her voice and her platform so powerfully. One particularly striking example of this was in 2021, when colleagues at the Ministry of Health were developing the new 10-year reproductive health strategy in the Gambia. And Dr. Mustafa Bitai, who was then the Director of Health Services, and Dr. Musa Marena, the Program Manager of the Reproductive, Maternal, Neonatal, Child and Adolescent Health Unit, contacted me to ask whether we could organize a policy dialogue focused on infertility. And at that time, infertility remained a marginalized and highly stigmatized issue, even more so than today. And it was invisible in policy spaces in the Gambia, as in many other countries. We had only a few days to prepare the agenda, and I invited Sainey to speak for 10 minutes at the start of the workshop. Sainey spoke for 40. Sainey's talk was so electrifying, and the Zoom room full of Gambian policymakers, planners, and senior officials was transformed. While we presented research evidence, Sainey brought something else entirely. She brought truth, humanity, and a deep sense of urgency. Every single stakeholder left that meeting convinced that infertility had to be on the policy agenda in the Gambia. It could no longer be neglected or sidelined. And many later said quite clearly that it was Sainey who so movingly convinced them of that. At that time, Dr. Anna Aferi was conducting her PhD on infertility policies and services in the Gambia, and Sainey was an expert key informant in Anna's study. Anna's work helped us understand the barriers and facilitators to the inclusion of fertility care not only in the Gambia, but Africa-wide. Anna also mapped the availability of infertility services in 38 public and private health facilities in the Gambia, and sought the perspectives of Gambian policymakers and health practitioners on implementing close collaboration with the Ministry of Health. We published several journal articles, we wrote policy briefs, workshop reports, and appeared in newspapers, blogs, podcasts, and on TV. Oh, the slides are taking some time to catch up. I'll just pause for the slides to catch up. And more recently, we used our learning from that study to explore infertility policies and services in a different part of the world, in Southeast Asia, a study which Anna will present later on. We also launched the White Rose Network for Fertility Care in the Global South with the vision of striving towards fertility care for all. And Sainey was a founding member, together with Suzanne, Anna, myself, and others. The network was in close partnership with Safe Haven Foundation, though it served a different yet complementary purpose. And in its early years, the network was very active with monthly meetings and membership spanning 16 countries around the world. And now, as we move into the next phase of consolidation and growth, we want to do so while honoring Sainey and all her contributions. The network was awarded the inaugural Presidential Medal by the International Federation of Fertility Societies in the 24th IFFS Annual World Congress in 2022. The competition was judged against 5 criteria: scientific rigor, relevance to patients and the public, novelty, scalability or transferability. As the recipient of the medal, it is very much a shared award that belongs to the network and to every single person who contributed towards it, including Sainey. The network was subsequently invited to publish an article in the journal Global Reproductive Health. But we didn't stop there. Sainey had a bold vision of launching Gambia's National Infertility Awareness Week campaign, with another public walk and with community and media engagement across the entire country. Sainey, Safe Haven Foundation, and our infertility research group co-designed the campaign together with community members across rural and peri-urban areas of the Gambia. And we had attached a research study to the campaign to help us understand its impact and so that we could improve it for subsequent years. We were due to launch this campaign together in April 2020, and Sainey had already arranged with the Gambian police. The virus that was rapidly circulating the world by then had other plans, however. So unfortunately, the campaign went on hold due to the pandemic and some budgetary constraints we faced after it. Nonetheless, we adapted, and in 2022, Sainey, with our research team at the MRC Gambia, delivered awareness-raising activities upcountry in recognition of the deep inequalities in access to fertility care information and services in rural areas. Sainey championed infertility awareness, understanding, empowerment, and support throughout the entire fertility care seeking cycle, which can be a long, complex, and emotionally demanding process. And Sainey understood that and could relate to that so well. Her passion and her deep motivation to help people and to create change was infectious. Sainey created jingles for Gambian radio stations, and she had plans in the pipeline to develop a Gambian TV series that featured infertility in an empowering way. Our colleague, Dr. Temitope Binjo, will later explain how crucial this is, given the way infertility is currently portrayed in TV programs and movies, based on her example from her research in Nigeria. Today, infertility is firmly on the Gambian policy agenda. It is included in priority number 1 of the National Reproductive Health Strategy, which has 11 infertility-focused interventions. Now has a fertility care society, which was launched in 2023, with many members joining us here today. And delightfully, there are a handful of Gambian babies and toddlers who were conceived via in-country IVF at private clinics, such as Dr. Matthew Anyanwu's Elimat Specialist Hospital. Gambians previously had to travel to Senegal or further afield for these services. Progress has also been made by the Ministry of Health towards the creation of a national infertility center in the public health sector, which will, inshallah, be able to provide care to all, regardless of their socioeconomic status. And these are remarkable achievements in the evolution of fertility care in the Gambia. And Sainey and Safe Haven Foundation were foundational to all of them. She was deeply proud of this progress, and yet I know she would be urging us forward, pressing for further action and deeper, more equitable, sustainable, and structural change. Sainey was unwavering in her conviction that infertility is a shared responsibility, not only a woman's burden. We engaged Gambian men in our research, many of whom told us that it was the first time they had ever had the opportunity to speak about infertility, some having carried the burden silently and painfully for the ways in which men also suffer and are failed by the reproductive health system that is meant to serve them. Dr. Fatou Balde is now taking that work forward in her PhD by investigating how gender transformative approaches can help support fertility care in the Gambia. And Sainey was involved in conceptualizing that work and in appointing and welcoming Fatou to the team. While I cannot capture all of Sainey's magic in this brief talk, and you will all have your own private memories and recollections and shared joy and grief, we undoubtedly agree that Sainey was a remarkable person, an accomplished leader, seen here receiving a business award from Madam Fatou Barrow, First Lady of the Gambia. And beyond all of these personal and professional achievements, Sainey is most proudly Sana's mum, her adored son, who she cherished and spoke of endlessly with pride and joy. Sainey's gift is that she created spaces where silence could finally be broken, yours, and it calls all of us to action. This is one of the reasons we have invited everyone here today, as we mark 1 year since Sainey's passing, to relaunch our network in her memory. This network exists because of Sainey, and it exists for the future that she believed in and fought for so fiercely. We would now like to have some brief pre-recorded remarks from Dr. James Carey, who's head of the Contraception and Fertility Care at the World Health Organization and the Human Reproduction Program, followed by 2 research presentations by Dr. Anna Aferi and Dr. Temitope Binjo, whose bios have been shared with you. After that, we will also view a video recording that has been made for Sainey. Thank you. No, wrong video, sorry. Sorry, tech, wrong video, the other video, please. The WHO. Thank you, sorry, we switched them.
Talking about an issue that affects millions of people around the world.
Can you put it louder, please?
Yet, it's still too often misunderstood or less understood. That issue is infertility. Thanks to
Can you put the volume up a bit, please?
it's becoming increasingly clear that infertility is common. It affects approximately 1 in 6 people globally during their lifetime. And it cuts across geography. Today, we are talking about an issue that affects millions of people around the world. Yet, it is still too often misunderstood or left unspoken. That issue is infertility. Thanks to multi-country data, it is becoming increasingly clear that infertility is common. It cuts across geographies, income groups, and gender. As with many other health-related issues, infertility is not only a medical condition, it is a social issue, and addressing it is a matter of human rights. Everyone has the right to decide the number, timing, and spacing of their children. And everyone deserves access to fertility care that is safe, effective, and free from stigma or discrimination. The causes of infertility are diverse. They include reproductive tract infections, hormonal conditions, and lifestyle factors, among others. With increasing age, ability to achieve pregnancy can also decrease, particularly among women. Despite infertility being common, access to fertility care remains deeply unequal, especially in low and middle-income countries. Infertility is often not included in health policies or financing or health insurance benefit packages. That is why the World Health Organization is calling for better integration of services to prevent, diagnose, and treat infertility as part of universal health coverage, your marital status, or how much you earn. Infertility affects both men and women. However, in many settings, women are disproportionately blamed for infertility. Yet the root cause can be a female factor, a male factor, both a male and female factor, or an unexplained factor. At the same time, men with infertility often do not seek healthcare for many reasons that may include lack of awareness, financial barriers, or social masculinity norms. To assist people with infertility, our efforts should focus on all people with infertility, regardless of their geography, income, and gender. And finally, we must be sensitive with how we talk about infertility. It is not a global crisis. It is not a failure. It is a medical condition, one that deserves compassion, evidence-based care, and open conversation. Let's continue to break the silence. Let's listen, support, and ensure that everyone has the opportunity to achieve their fertility preferences, goals, and aspirations. And thank you very much.
Thank you.
No, we went from slide 37. Okay, hold on. This slide. What's coming? Is that it? No, but it goes on. Yes. Yeah. Okay.
Good morning, everyone. Welcome to you all, and the people that are joining us online. After a very emotional first session of this event, I am tasked to ground the audience with some data, research data. But this is what also Sainey legacy and how her work here pushed us to see otherwise in the world. And I'm honored to present the preliminary result of an assessment on infertility policy and services in the WHO Southeast Asia region. The project was implemented by a consortium of entities, including UK universities, Nepali NGO, university in Bangladesh and in Thailand. And my name is Anna Afferri. I'm a senior research fellow at Canterbury Christ Church University in the UK. Southeast Asia region, also called CRO, comprised 11 countries, and specifically Bangladesh, Bhutan, North Korea, India, Indonesia, the Maldives, Myanmar, Nepal, Sri Lanka, Timor-Leste, and Thailand. And this research was implemented in 8 out of these 11 countries. This was a multi-country quantitative online survey where participants from December 24 until March 25. I will show you some of the preliminary results of this very interesting study. First of all, is that this you have the list of the countries that were included in the study, and with a varied representation from each country, a total of 20 participants were retained and collected data from. 80% of these 20 participants were from the National Ministry of Health, of public health facilities, and there was equal gender disaggregation between male and female participants. As I mentioned previously, we used the WHO health system building blocks to analyze this data, and the first of these blocks is leadership and governance, and basically we were interested to understand how many countries has included infertility, availability of guideline for the management of infertility, and many other indicators. And despite over 60% of the country has indeed included infertility in the national health policy, only 37.5 had availability of guidelines for the management of infertility developed by the local Ministry of Health. The second building block assessed and target service delivery, and we were interested to understand who have access to these infertility services and where these infertility services were. And most of the country access and allow access to infertility services to heterosexual couples. The picture for same-sex or single parent is completely different, except for Bhutan, where apparently single male or single female has access to infertility services and can be parents, single parents. Where are these services? Well, not surprisingly, they are concentrated at the second and third level of care. This is not a surprise because infertility is considered a specialized care. Nevertheless, this points out to the fact that people living in rural area, isolated area, where only primary level of care is available, has no access to any form of infertility services, even the basic diagnostic, not talking about treatment. The third building blocks tell us about financing and the availability of a national public budget to cover infertility, or mechanism of national insurance covering partially or totally infertility services. And you can see here that the picture is quite striking, and with the exception of Maldives and Thailand, there are no national health budget in this country that has allocated to take care of infertility services. The fourth block speaks about health workforce and the availability of qualified personnel health personnel and the availability of training for that. And here the picture is much more reassuring in terms of the country cited that they have indeed personnel that is there delivering and providing infertility care, and they have capacity to train them. Where this health staff is working? Well, this picture mirrors the health services availability, and the majority of these doctors and nurses are concentrated and deployed at the tertiary level of care. Again, primary level of care for people that live rurally is absolutely missing personnel to take care of these patients. The fifth building blocks target medical, product and technology. And we were interested to understand if essential fertility medication as included in the Ministry of Health national medicine list. If availability of IVF laboratory was there, and even diagnostic means. And if 75% of the country has said that they have indeed fertility medication included in the essential medicine list for diagnostic like hormone assay, the picture is quite different. And from who of you that know the Gambian health system, you can probably and that follow our research on infertility here can say some similitude, because it's quite the same picture in this country. So the data that I'm showing you are not so different for us, not so striking, but they mimic really other country in the global south. Lastly, the last blocks is talk about health information system, and so how these countries collect data on infertility, how they report data on infertility. And to summarize these two charts, the findings are that the majority of the data on infertility are collected in this country via survey assessment, or not collected at all, rather than using the Ministry of Health health data collection. As many research study, even ours, has his limitation, of course, a incomplete representation of the 11 countries targeted in that region, a small sample size that could have not fully capture the different perspective of a complex health system. Data were self-reported, so it could be that a different interpretation about infertility policies were done. The survey was administered only in English, not counting for maybe participant that has lower comprehension of this language. And this was a cross-sectional survey that in research it means you take a picture, a snapshot of a particular point in time. But this doesn't give you the changes of the trend. And so forth. This is why more longer studies are needed. Nevertheless, despite this limitation, we want to also issue some recommendation. And apart strengthening the national policy in those countries that has not yet included infertility in their regulation, it's very important that there is an expansion of infertility services, including at the primary level of care, maybe just with diagnosis and prevention activities, but there should be there. It absolutely needed an increase in public funding allocated to fertility care and the expansion of national insurance schemes to allow more people to benefit of infertility services. There is an investment in the development and training of healthcare providers And in the case of this study, is particularly true for the country as Maldives and Timor-Leste. And finally, there is a need for strengthening the health information system. Data on infertility must to be collected, and is through that country has a real perception of the prevalence and the impact of the disease in their country. I would like to conclude. Thank you, our founder, the WHO organization, the Department of Family Health, Gender and Life course at the CRO regional office. And I leave the floor to my colleague, Dr. Temitope Labinjo, that she's online. She will present you her research on infertility in Nigeria. Thank you so much.
Tammy, are you happy?
Hello, everyone.
Go ahead. Yep.
Can you all hear me?
Yes.
Okay.
Yes, we hear you.
Okay. Just going to. Hello everyone. My name is Senator Ferrabinjo. I'm a researcher at the University of Liverpool, and I just want to say thank you for inviting me to make this presentation at this glorious event. I'm going to be making a presentation based on the work that I published at the Journal of Culture, Health and Sexuality. So my work is presenting the findings from my study on how infertility is portrayed in Nigerian movies, particularly within the culture of Nollywood. So Nollywood is the center for Nigerian movie industry in Nigeria. So this work is grounded on the Nigerian sociocultural context, where infertility is closely tied to identity, marriage, and social value. By analyzing this film narrative, the study is going to be exploring how popular media both reflect and reinforce stigma, gender norms, and the mental health experiences of women living with infertility. So I'm just going to give a brief context of infertility in Nigeria. In Nigeria, infertility is highly stigmatized and rarely understood as a shared health issue. Cultural and religious beliefs often frame infertility as a woman's failure, regardless of the medical realities. And women who experience infertility may face blame, exclusion, and moral judgment, which can sometimes have serious psychological and social consequences for the women. So Nollywood is not just an entertainment platform. Nollywood is a very powerful cultural institution with significant influence over public attitudes and social norms. Most of the films shape how the audience understand concepts like marriage, motherhood, and even gender roles. Because of this reach, Nollywood has the ability to either reinforce harmful stereotypes or challenge them. So the aim of this study is to, first of all, examine how infertility is culturally represented in the selected films, and also explore the psychological and emotional impact of these portrayals, and finally to analyze how stigma and gender dynamics are constructed and sustained throughout the film narratives. So for methodology, I use what is called qualitative content analysis to examine 4 Nigerian movies in infertility, using infertility as the central theme. The films were analyzed thematically, focusing on cultural beliefs, emotional distress, and societal pressure. This approach allowed for a more in-depth exploration than just, measuring, rather than measurement. So, like I said earlier, I selected 4 themes. One of the films was called Where the Wind Blows, was produced in 2024. The second one was The Wait, called The Wait, was produced in 2021. The third one was 3 Nights and 3 Babies, was produced in 2024. And finally, Wives and Infertility, also produced in 2023. Individually, in Ife's story, in Where the Wind Blows, it focuses on secrecy around assisted reproduction. She used surrogacy, but she had to hide it by wearing a fake pregnancy bump. And this reflects the fear of judgment, gossip, and rejection. And can you hear me? Excuse me.
Can you? Technical team, we're not ready for the video yet. Tech team, can you remove the video, please? And this, thank you. Okay, thank you, Tammy. Go ahead.
All right, thank you. So, in Ife's story in Wind Blows, she had to use surrogacy, and she had to hide the fact that she was using surrogacy because of fear of judgment and gossip from people by wearing a fake pregnancy bump. So alongside the surrogate, she had to also pretend that she was pregnant. And this reflects fear of judgment and rejection, and shows how stigma shapes our reproductive choices. In Sharon's story in The Wait, she had to withdraw socially after experiencing repeated miscarriages, and so she had to isolate herself behind closed doors, experiencing deep grief and self-blame. However, a social support group eventually became a turning point for her, highlighting the importance of shared understanding and peer support. Judith in 3 Nights and a Baby, it highlights the emotional sacrifice that women go through. So Judith had to agree to a second wife for her husband to preserve her marriage. And she was outwardly praised as a good woman, but inwardly she was left emotionally broken. And her pain remains invisible because her value was tied to motherhood. Finally, Jane's story in Wives and Infertility. Jane experienced how infertility becomes like a public show or a public property. She was accused of witchcraft and immorality and pressured to marry a second wife by her mother-in-law and her extended family. And this constant humiliation eventually forced her to leave the marriage to protect her mental health. So, using the conceptual framework of the feminist and sociocultural theory, concepts such as the hemiplegic motherhood, reproductive agency, and gendered power explain how infertility is portrayed. So in this slide, you can see the woman's lived experiences in Nollywood. It shows how it's portrayed in terms of the cultural beliefs around infertility by family and friends and in-laws. When a couple is unable to conceive after a while, family, extended family begin to put pressure through either cultural norms, spirituality, and things like that. And then it makes her to be defined by infertility, because not being able to bear a child affects her status as a wife or as a woman within the society. And also, she's framed as a failure. She's seen as a failure due to the inability to conceive. And based on that, you can see also she has to now at some point either compromise or resist by either accepting polygamy or accepting a secret child, or just having some forced compromise, like in Judy's case. And this eventually leads to emotional distress, silence, or isolation. And then eventually, sometimes might decide to accept or negotiate or undertake resilience strategies, either using religion or have faith to be hopeful, or just fight and regret, like in Jane's case, having to leave the marriage for her sanity, or just engage some other coping strategies, like in Cheryl's case, joining a support group just to help their mental health, or just undertaking some kind of restructuring of their lives. Or mostly in the stories, I found out that even though it wasn't written in the paper, majority of the women, exception of Jane, used religion mostly to cope, and eventually they had children, or some of them went into adoption or surrogacy, like in Ife's story. So it just portrays, Nollywood portrayed the lived realities of women and how they had to go through all these issues to. So the findings of this paper suggest that Nollywood has the potential to do better. More balanced narratives could present infertility as a shared issue, including male experiences, because even in the stories, male infertility was ignored and was concentrated more on the woman, and portray assisted reproduction more positively. So collaboration between filmmakers and public health advocates is very, very important. So finally, I would say Nollywood often reinforce gendered expectations and stigma around infertility. However, because of their cultural power, it's also important to offer an important opportunity for social change through more empowering and inclusive portrayals. So, in fact, Nollywood is a very big platform, and majority of Nigerians enjoy Nollywood, and it also shapes our beliefs and attitudes. So, Nollywood has a strong potential to change the narratives around infertility and making it more inclusive and more empathetic to people with infertility in Nigeria. Thank you all for this opportunity.
Thank you very much, Temi, for sharing your results, your study with us.
Thank you. Oh, sorry, stop sharing.
So we stopped sharing. So we will now share a video that has been made as a remembrance. Okay, thank you.
Good morning, everyone, and thank you all for coming. We have put through together a short video from family and friends. Okay.
She was incredible, and she had the best qualities. She was genuinely a good person. Inside, she was the life of everything. She was incredible, and she had the best qualities. She was genuinely a good person. Inside, she was the life of everything.
So I met Sainey for the first time in the Gambia National Museum. I was introduced to her because she was also working on infertility. And I went to the first march for women to fertility. And I was so impressed by her kindness, but also by the way she really pushed for change.
Person that I confided in most. She was a trustworthy person. She was my go-to person. She was somebody that I always rush to whenever I have problems, whenever I am stressed, or whenever I'm lost in this world.
Sainey Dumera. I haven't seen Sainey get upset ever. Sainey duñ ko xool façon bu nekk dafa ree rek ko wax mu ne booy laa ooyee ñëpp. Sainey ñu de waa nit su baaxee du yàgg si àddina. Sainey was one of those.
Sainey was so much fun to be with. She was more relaxed, and I am the principal one, so she helped me change that. She always interacted with me positively, helped me view things in a positive way, and not to stress about things that I cannot control.
People here know about Sainey's professional work. One thing that I also admired about Sainey was her dedication and her love for family. And a lot of people will remember every Ramadan, Sainey had stories about her father that she would come and bring on Facebook, on her social media platforms. She shared with us that she came from a loving environment, from a loving family. And for me, that is something that I would always remember about her, the fun part of her.
Hello, good afternoon. I'm Linda. I hope you're in Pijama. So I'm going to just have a quick video regarding the taba. In the waffle here. I feel the need for my raise awareness on it. Young man and give yell on it. And then buy taba back. Yeah. I money take us. Console so I mean definitely I'm wrong. The flooding suffer. So in suffer the plan on the money for the conceive. No, we couldn't go on cooling. Bulan can stress them. Can stress them. Bulan now healing and don't heal one little. Bulan can stress in stress for hundred. Then another loss and papa. They use the only go inside and do another. Can get a position.
This was all that I really did Gambia forward in what she was doing. Then Mukimo would save heaven. Mungeko no hamle seen gumla. The gumu gonna come def ko dista. Why def ko gumu? Ko def. This is of time. This is of halis. This is of resources taken away.
Most of the issues that Sainey fought against are issues that generally in the Gambian context people are quiet about. So for example, the issue of infertility, which carries a lot of shame and stigma. Sainey came out, used her lived experience to talk openly about her personal experience, and in doing so, empowered other women and provided them a space to speak on issues around infertility.
Sainey gis nañ yaa ngi def liggéey bu bari si lii. I follow you on social media and I see yaa ngi set up a foundation. First and foremost, lan moo inspire pour work on fertility pour jigéen ñi nga jàppale leen di leen cancel ak obviously lan moo la inspire si loolu.
Okay, Fatou jërëjëf. Thank you for having me. Foundation bi man yàgg naa bëggoon a def something about infertility. Parce que ki ma yar dafa sëy for more than 25 years amul foofu doom. Léegi góor bi mu gaañoo dafa gaañoo rek ñu bëgg mu génn. Waaye fortunately for her moom daf doon yar nit ñi rek. Daf doon yar xale yi. So bi mu demee rek gaay mag néeg bi daf doon bëgg a collapse. Understand? Kenn si ki mu yar
alhamdulillah yàlla ko defal jàmm ci kër gi ñu defaraat foofu noonu and everything so bi ñu gaañoo bañ ne dafa war ñu génne doomam yi ne maam yaa bi génne kër gi parce que ñoom dañ war a ñëw foofu noonu because moom amu fa doom understand nga so ñu dem ba ñu yóbbu ko ñu dem ko daal léegi court bi rule in favor of Hannah because renovate néeg bi bu yàggut ak yooyu noonu su ñeen mënee delloo amaan bi ñu renovate néeg bi then meer bi dina génn and everything understand nga so yàlla ba suñu koppa ndax bu sedd daal waaye dafa affectoon ki ma yar torop so ma ne lii is not right maybe man su ma demee ba toll si yenn stage bi I'll do something pour ma dimbale façon jigéen ñi daal so loolu was years back man itamit ma dem ba sëy and ma gis ne man like the first year maa ngi try second year maa ngi try understand mu ngi hard difficult and everything te xam naa léegi-léegi ñu dee feel léegi fa da nga ew sax toog na doo bëgg a lam fa bitaal because yaa ngi depressed and everything infertility dafa ñëw ak depression understand so for man am ñu laa waxal ñu understand yow li nga go through pour nga mën a live by the day.
Sainey had such great attributes. She touched so many people. She's done so many great things. But if I were to sit here and list everything my sister has done, I would be here all day. But then I realized I don't have to do that for her because that woman made sure that she did that for herself. She left behind such a great legacy that her work speaks for itself. I wonder where she had the time to help that many people. Sainey was what, 41 or 42 when she passed away? When did she have the time? She has done so much in that time that she was alive than most people have done in 80 years.
I think that where infertility is prioritized now in the Gambia. 10 years ago was not like that. And thanks to her work initially and the work that was conducted later, we have now infertility in the policy document in this country. There are several infertility clinics providing services for couples that cannot conceive, and there will be more work on that sense in terms of availability of services.
Researchers, my colleagues, Dr. Dirks, Dr. Ferry, other colleagues, myself, and of course Sainey and many others, we founded a network on fertility care in the Global South. The aim of that network is to improve access to fertility care for all who need it. Sainey was a key member of the network, and we were all devastated by her loss. So we've come together in her memory to rebrand and relaunch the network in her memory, now named as the Sainey Ceesay Network on Fertility Care in the Global South. The reason began at the following day, the Minister of Justice would find out about certificates and everything. The Moromba Independence Drive, the Cabello Jigel, we do fertility clinic. The Banya Joy. Hanga, Namiko, and the Joy, Minoma did it, Dara. Madam sama kër maa ñëw ak Roma fekk ko fa mu ngi jooy ma ne nag kii dama dem fekk ko ma lan laa jooy ma understand léegi parce que ma insist dam ne ma comme moom saa yu nekk ay every 3 months yooyu noonu daf di ñëw si clinique bi foofu noonu pour seet la confirme na ona te saa yu ñëwee she's been married for 9 years saa yu ñëwee rek dee lot ni understand comme bu dee jooy xol faa mais moom bu ñu daa dellu kër sax comme dee dundaan bi dee mu ko gënal because kër amu fa jaama takal nañ di karam jabar bu yàgg waaye still su toogee sax kenn du ko nekk ak yu noonu xam nga loolu ñaaw okay I have to do something because nit ñaa ngi sonn. We all miss her at the center, we all miss her at the walk, we all miss her at the foundation. I can say we have lost a great person. somebody who was dedicated, somebody who was committed, somebody who believed in what she was doing.
I miss her laughter. I miss her sense of style. I just miss her silliness. I just miss being with her. Sainey, you will never be forgotten. We love you so much.
Well, ladies and gentlemen, I know the room is so full of emotions right now. It has not been easy for all of us in the past 1 year. Everyone is crying right now. My mom just almost fainted because of how close she was to Sainey. With me personally, I've been together with Sainey probably from birth. Anybody who knows Sainey personally would definitely know Sals, which is what they nickname me as. Like, my name is Salimatu Balde, but everybody calls me Sals. Me and Sainey moved together in the UK as well, back in 2001, 2002, and we've lived together since. We've lived together, and also until she came back to the Gambia, finally, after she got married. We've cracked so many jokes together. Personally, she is my best friend. She meant everything to me. I had a baby 3 months ago, and I was like, before I conceived, so when I realized that I conceived, I was like, oh, I should name my baby Sainey. But then throughout the pregnancy, I was like, no, I can't, because I couldn't personally get over her. I think about Sainey every single day. And then when the baby finally arrived, I was like, this is gonna be for my mom, even though I wanted her to carry my mom's name. But when Sainey passed away, I was like, this is gonna be Sainey. But I realized that I cannot name my baby after Sainey, because I just wanted to kind of like have something to, like a little bit forgetfulness about Sainey, even though I don't want to forget about her, because obviously what she meant to me, but it's like I cannot have this carry on forever. If I had named my baby after Sainey, it would have been something that would carry me for the rest of my life. I don't think I'll ever concentrate and focus on certain things. So I was like, no, Sainey, let me just keep this one. Let me just give this name to my mom. So we connected in so many ways. Every single thing, like any jokes that comes up, or my son did do some crazy stuff, she's the first person I would send a video to. And she would just come back to me with her infectious laugh, soothing every single thing on that video. I was like, so right now it's just like, I'm really bored. Because when my son do certain crazy stuff, I was like, I don't have anyone to share this to. And it's like, it's very painful. It's very, 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 very painful. She's the one that I connected through every single thing. And when we lived together, obviously we both we both kind of like didn't know what was ahead of us. We were young when we were in England. It's only after she came back to the Gambia, then that's when she realized that she had some infertility issues, or even I experienced the same thing, because I got married in 2019, and I had my first child after 7 years of marriage. So I know the stigma. I know how frustrating it is. I know how bad it is when people keep telling you, oh, when are you gonna have a kid? When are you blah, 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 blah. So I was like, I'm just like many people right now, because I see how many people are facing like infertility right now in the Gambia. And I was like, I just have to accept it, that it's not just me who's facing this, but it's just nice for people to talk about it more often, because there are so many people who are suffering in silence when it comes to this infertility. I'm just unfortunate that now God has blessed me with 2 kids, but after almost like more than 10 years in marriage. So I know how it feels. I'm smiling now, obviously, because it's just that, it's just now through this work, obviously with Dr. Fatou Balde and Professor Belen and the other people, that I know how much she was involved in this. Many people in this room didn't know how involved she was with the work. We all know that she was doing some work with the infertility and with other foundations, but we didn't know to this, I personally don't know it was to this extent. And thank you so much, all of you, for this thing that you've brought together. And obviously, and I thank everybody in this room for paying their sort of like respect to Sainey, and we all know how she meant to us. Thank you all.
Okay, Assalamu alaikum again. I know it's a very heavy afternoon for all of us here today, but we wanted to use this opportunity to remember and honor Sainey. The network itself is, everyone in this room here will agree with me that we felt Sainey. We felt her vision, and we felt what she wanted to do, the support that she wanted. And I think also beyond the issues around infertility, Sainey deeply cared about reproductive health, women's health in general. I hope this inspires us today, beyond this room, that we all take a stance and a promise that we will support to see how the Safe Haven Foundation continues. Because if you love and care about Sainey and the work she did, this is an opportunity for her legacy to live on. But I just wanted to emphasize that the network is a global platform, and we've got people across the whole globe, Australia, in Africa, Europe, everywhere, who are members, including researchers. You saw the speaker from the WHO. It's very diverse. But what we have at home is the Safe Haven Foundation. We also know that there are so many Gambian women and men who are affected, who infertility affects. So how can we use this platform that Sainey left us to continue her legacy, but also provide support so that we can continue raising awareness on these issues that she cared about? We are going to leave the floor open. First, I would like to invite Sainey's family. So, things are very emotional for us. We really appreciate you being here with us, for joining us. Mr. Ceesay or ma'am, if you have any words that you would like to add, either where you're sitting or up here, we would like to give the floor to you. And after that, anybody who wants to contribute any remarks, anything you want to say, please do so. We also have a book at the just near the door, a condolences book. If you are uncomfortable standing up or saying anything, the book is there. You can write your remarks, and we will hand over this to the family as well. Also, the family, the video will be made available to you. You can have it for future reference if you need it. So, yeah.
Mr. Balde will speak on
that. Okay.
Oh, you can.
Distinguished guests, respected colleagues, ladies and gentlemen. I commend the organizers and partners for their vision and commitment to advancing equitable fertility care. Again. Today, this area of affirmation of purpose, it reflects a renewed dedication to research, policy, and particularly in Global South, where the needs is great and the voice are too often unheard. The legacy of Sainey Ceesay stands as a reminder that meaningful change is driven by compassion, collaboration, and courage. This network has the potential to strengthen healthcare system, inform policy, and support families through inclusive and culturally responsive approaches. As stakeholders, researchers, practitioners, policymakers, and community leaders, we share a collective responsibility to translate knowledge into action and end. I therefore congratulate this team on this milestone and wish the network every success as it moves forward with impact and integrity. In conclusion, I wish to express my sincere gratitude and appreciation to all who have contributed to the success of this occasion.
Baba, it's okay. It's okay, Baba.
Your comments and collaboration and shared vision continue to inspire purpose, to inspire progress. Let us move forward with renewed purpose and unity. I fully remembered when Sainey Ceesay was on her sickbed, first time all her brothers and sisters would always call me Tom because of the namesake, because of my namesake Musa, the first son of Moro and Sainey, Moro and Njeme. Sainey told me, Papa, don't worry, I'm fine. That day I nearly cried. I thank you all.
Can you come? Okay. Can you come to the podium? We cannot tell. I cannot tell. You want to sit there? Okay, use the mic.
Thank you. Good morning, friends, family, friends of Sainey. I'm Ibrahim Anjay. I'm Sainey's first cousin. My dad is Sainey's mom's elder brother. Yeah, I basically grew up with Sainey and Sainey's brothers and sisters. I went to the same primary school with Sainey. I was 2 classes ahead of Sainey. So Sainey will eat lunch together during break time and stuff, that. Then Sainey will say, oh, I'm going to go to my big brother. Then we'll walk together home. So even when she was in London studying, I was in the United States also studying. So we kept in touch. She was very respectful and very disciplined and very courageous. Yeah, we discussed a few times about his fertility care because as you all know, she got married, and it took a while and she couldn't conceive. So, but in all this, she was very courageous. So what Sainey did was an act of hope, and it reflects the deep awareness of the silent struggle many families are going through. And people, like the stigma, a lot of people are ashamed to discuss it. So they'll come to people like Sainey and discuss it, and Kenny will give them a lot of courage. And in their private meetings and stuff like that. Because it's a very emotional topic. And as we know, Gambia, if you get married for a long time and cannot conceive a child, and some people like Sainey have brought a lot of awareness through treatments, encouraging women going through schools, encouraging girls, discussing, talking to them and about it, and and so on. So I would like to take this opportunity to thank the people, the doctors, everybody who's present here, and the doctors who came all the way from England, and the professor that talked from Nigeria to say thank you on behalf of our family, and we'll also try to support you guys to continue the Safe Haven Foundation in honor of Sainey Ceesay. So I will say once again, thank you all.
Thank you. Sorry. Yes.
Hello.
Yeah, this one is working.
Okay. We would not do justice if we don't talk about Sainey without the laughter. Sainey was known for her laugh. Sainey was known for making everybody fun. So I'll just share a few stories about Sainey, because as Salimata said, we all live together in England. So one of the best stories I have is, as Salimata said, they lived together, they did everything together. So there was this day, so guy didn't joge Antiande, and then they was without any ticket, or they'll get a cab. So this particular day, they got on the cab. So all of them. So guy took a taxi to Amun Pass, which was very normal for Sainey to lead anyways, if you know Sainey. So guy dem bediga, Salimatu mune kone, why boy, pass bi nak Sainey mune kone, nañ hulo. So suñu hulo ye, suñu driver bi dege ñuy hulo, duñu feye ko pass. So guy ne bahna. Guy dem rek Sainey gestu ko, boy, where is the money? Salimatu, I lost it. Guy do di hulo. Hulo bo xamne sax comme liñ bëgg waxante yépp waxante nañ ko ci hulo bi daal. Guy dem be ega. Driver bi ne ala sen pass. Guy ne ko, but didn't you see us? We're fighting over the money. She left. Driver bi ne len lan delo len ba fañ joge won. Ba pare ne len di ñu fay. So these are a few stories of Sainey. Man dama daan enjoy di ko togn because man daf ma saga rek. So that's what I used to really enjoy, to the point that every day I would have to provoke Sainey whenever I see her. So there was another time, again, I do London def. That's what we used to do. So I'm in school, watch it, then you work. So this particular day, you work, train yep teach, boss yep teach. So we were stuck in the middle of London and didn't have anywhere to sleep. So legi ñu ngi wara dem ci kër ben antem. Why I wasn't even part of it, but I followed them. Ñu éga ba fofu dal situation bi anti bi mu ne ñaari nit ñoy fanaan. And we were already 5. Mané ko wa Sainey legi wax ko mu lalal ñu ci biir baat top bi. Mu ne mané you like nopil mané okay. Anti bi insist dal ne only 2 people would sleep there. And I was like, okay Sainey, why not ñu dem si club bi ba borset su leeree rek ñu dugga train dem suñ kër mu ne ma no yéen fine leen seen wéy daal so mu choose kenn ki ngi doon kooku comme gan la suñ biir daal mu ne moo ngi dem fanaan at Antibal kooku so man Salimatu and someone else we were stuck. So after we ended up calling Fadia, Magi Salimatu, and then she called someone. So we ended up going to Awanjai's house. This lady, she was very nice. So we went there. You talk maybe an hour later, like saying, boy, Calendem Club. Manako la find your way. Nyun right now. Your house len rere. Nyungi ni teda si bunk bed. Sangu. You can find your way, my dear. Why? Honestly, no. We are not going to the club. And these are just few stories about Sainey. Dinañ duga train no bus pass. Duga bus pass mu jité affaire ci nak. Ne boy topalen suma kana bu len wax. Bu len dega olof. Bu len nopi len rek. So that's exactly what we would do. But that was Sainey, and I think we would not do justice if everybody's here and we don't talk about the stories we have. As I said, Sainey man musuma ko gis mu mer. And I've known her pretty much all my life. So ñu ko ñaanal yal na ko yàlla xaare àjjana ñaanal doom ji yal na ko sut fan yal na fi mu dem gënal ko fii mu jógee.
Assalamu alaikum everyone. Man maa ngi tudda Awa Bling. Sorry. Maa ngi tudda Awa Bling. I'm a hip hop artist and an activist. Yeah. Sainey was just an amazing person. Man maa ngi meet Sainey through a training I was invited at by Fatou Balde. So she came and explained her story, and that day I could remember that she cried. I could see how hard is what happened to her, but she did, and we were all inspired when it comes to advocacy through music. So I am also a student. There was a time I organized a training at MDI. And Sainey came. So man dama wax ne tay suma ñewuton fi kon gorew ma because dafa ñew mu share story am fofu nonu mu pare pour dem ma pare pour jox ko pass mu ne mukk mu ne du ko jël mu ne ma ne Awa I'm not doing this because of money. You are doing great and keep it up. So man, today I feel emotional because I worked on an album with other artists from different parts of the world. There's this white lady in Canada, Momo, organized everything. And I used her story in my song. The song was about FGM. So I actually got consent from her to use her story, but Luma Meti Moine, she didn't even get to listen to that song. But I will share it with Fatou and everybody. So it's advocacy through music, and her story is really authentic. So I believe that we should, it's just so hard. But anyways, I will share the song with everyone if possible. Then feel free to use it in documentaries, advocacy, campaigns, whatever it is. Yeah, thanks. And also, I hope this serves as a reminder to everybody, especially young people. Baax rek am solo. Liggéey bu baax rek am solo. So whatever we do, nen bàyyi xel ne someday dinañ fi jóge. And ku nekk ñaan nga tamit pour nga am something like this, like a legacy, ba pare nga am nit ñoo xam ne dañ laa taxaw. Because Sainey nekku fi right now, but documentary buñ seetaan rek wone na ne bu fi nekkee amoon na ñu ko taxaw. So ñun ñëpp ay nit leen. Let's continue to support one another, love one another. And yeah, as for me, I'll continue to use my music to raise awareness. Thanks. Yeah.
Statement. Statement.
Assalamu alaikum. Good morning to everyone. I know it's a very heavy day for all of us present here because ku xam Sainey, ku war a wax baaxaayu Sainey tey duñ fi jógee Man personally, numa xamé Sainey mo nek I'm gonna mix both English and Wolof. How I got to know Sainey mo nek in 2015, dama nekkon Malaysia. Sainey too was in Malaysia. So xam nga diko jóobeen rek ñun fuñ nekk fokk ñu wone suñu baaxi maam. So ma bëggoon a togg ebe. I wanted to cook ebe. I got on Facebook and I wrote, any Gambian in Malaysia who can help me know where I can get tapioca, that is cassava, yami. Then somebody said, I know I have someone in Malaysia called Sainey Ceesay. Harama link up with Sainey so that Mudimalila and tell you where you can get the tapioca to make your ebe. Sila them. The person gave me the number. I contact Sainey. She told me the market, the price, and everything. That was how I got to know Sainey. Sainey. And a few months, funnily enough, before I left Malaysia in May, I was sacked from the NCAC. Then I saw Sainey was employed at the NCAC as the marketing manager. I'm like, wow, Sainey, I am going out, you are coming in. But don't worry, I'll be your mouthpiece in that place. And she started to work at the NCAC. I was her guide. And after 1 year or two, I was recalled back to the institution. And right now, as we speak, I am the new, Sainey was the marketing manager. Currently, I'm holding her position as the marketing manager. This position was in the work that Sainey has done at the institution, Munuma Hafi, Munuma Quarterly, the strength, the passion that Sainey has. Gari ma de wax na yow so melo ni Sainey ma ne ko man munuma mel ni Sainey. Sainey dafa am kattan, dafa am doole. I can remember a few weeks ago, when we were inaugurating our new board, Minister dafa taxaw ci kanam mu ne ndeysaan Sainey su fi nekkoon, because we know the work and the passion Sainey lu ngee def ci how the energy she puts into the work. But I am trying as much as possible to inspire her. Ñun dëgg su fekkee wax dëgg rek mënuñoo fàtte Sainey NCAC. Every time meeting for them Sainey moo dee ñëw. She's always stopping. Even so much so that even the president himself recognized the danga sawar si li nga def man na mëna Sainey torop. Sainey suma waay la woon ku recently lam amoon 1 year wam bi mu ngi dooroon a jot this year ma dem si bàmmeel bi dem siyaare ko parce que moom ak suma yaay ak suma mag ñoom ñëpp nañ denc si benn bàmmeel Kanifing. Ma dem siyaare ko di ko ñaanal. Sainey duñ ko musa fàtte parce que ndaw la boo xamante ni am na jom, am na fulla, am na fayda, bëggoon na lu muy def. Man nama naa ko torop parce que Sainey am na kàddu yoo xamante ni moom rek moo ma ko sañ a wax si NCAC daf maa oo rek mu ne ma yow xam nga yow danga mën a duur kaay ma ne ko Sainey la tila. You am that conversation. Sainey duy mer de, duy jàpp si xolam de, te doo waxi keneen si kanamam. Munta nekk possible sa kaay yaa fi de dégg naa ñu ne diw sangam mu ne mu oo turi kooku ne yow yaa wax ma ne ko déedéet buñ dem nañ dem si diw sangam. Doo jëw si kanami Sainey. Loolu moo tax she was a unifier of the institution. Sainey moo ñu dee unify ku fa am problème si Sainey nga dem, ku fa am jaaxle si Sainey nga dem. Kon suñu waxee ne nama nañ Sainey namuñu ko lu ndaw. tey dañ ko bëgg a appreciate dañ ko bëgg a appreciate bëgg ko recognize di wax family am bi ñun NCAC fàtte wuñ ko this yes representative certificate please. Okay, Sana, yes. Sana Bunda. Sana Bunda. Sana boy. And lastly, I would like to thank the organizers of this. Dilemma, thank you very much for carrying on this legacy. You may not know how important it was to Sainey. Personally, I was a board member. Why the mother had because I'm gonna man out my time. The money was seriously Sisuma Foundation. And because I had some other commitments. But I just want to say thank you. You guys did a really wonderful job. And I know ne Sainey fu mu tëdd na le kontaan trop because lii lum bëggoon la si xolam lii lum dee waxtaanee with passion su ko dee waxtaanee sax yow soo demut moom du musa jeexal so maa ngi leen a wax jërëjëf di leen ñaax di leen ñaan li ngeen commencé ni yal na si yàlla def barke yal na si yàlla def jàmm yal na law yal na toog ba nga xamante ni duñ ko déggee Gambia rek dañoo dégg naan Sainey Foundation bi de dem na place. Thank you very much. Okay. Sorry.
Assalamu alaikum wa rahmatullah wa barakatuh. I cannot say much about Senegal. I used to call her Senegal. That's how I call Senegal. Senegal. Sainey is my daughter. Her father and my husband, they are all from the same father. Let me say mother and father. What the last speaker said, that Sainey does not want to say anything bad on people, is quite right. My daughter Awa, she cannot come. When I told her about this program, she shouted and cried. I told Baba Murudo, Awa cannot come here because she will commit problem and people will not be able to do this program. Let her stay back. Everybody knows Sainey and Awa. They are first cousins. Very well. And I'm happy today that people are saying something on Sainey, which made me very happy and proud of myself. I know Sainey very well. I know her. The last speaker, what she said is quite right. When people are sitting down, if you want to say anything bad on somebody, she will get up. That's her habit. I'm happy today that everybody have said something which is very, very, very good on her, where she is. That's what God wants. That's her life. And I cannot say anything about Sainey because much has been said and plenty is left behind. But the Almighty Allah, I'm praying for Him to give Sainey a home, a very high home in Jannatul Firdaus. The only thing I have to say is those people from England.
Thank you. Good morning. Assalamu alaikum. So, coming here today, I have no intention of saying anything or speaking. I just wanted to attend of Sainey. But sitting here, I felt I needed to. I knew Sainey, or I met Sainey in around 2003 in Birmingham when she used to live with Yasali. And from what was mentioned in the documentary, Sainey had this ability to, and there's this ayah in Surah Yasin that I like to use quite often in my advocacy. And it says, and I will say it Arabic and then I'll explain what it says. Inna nahnu nuhyil mauta wa naktubu ma qaddamu wa atharahum wa kulla shay'in ahsaynahum fi imamin mubin. So in the Quran it says, God says, I am the one who raises the dead, put forward, but I have also recorded the footprints that they left behind. And all of this I have recorded in there is about leaving footprints. The part that you put forward, that is your personal thing. But leaving a legacy. In this world, we are all bound to leave at some point. Death is inevitable, right? But the most important thing that we can achieve in this world is to leave a legacy, to leave those positive footprints. And a room full of people commemorating somebody's memory. If you can have people leave from abroad to travel to come and attend a commemoration of a person, that person has left footprints that are really something to emulate and something to be in awe of. And I would just like to conclude by also again quoting another Sufi that a lot of people, I think, ascribe comments to, and that is Rumi. And one of the sayings that are ascribed to him is that he said that when we pass away, don't look for us in the tombs, in graveyards. Look for us in the hearts and the minds of those people that we have inspired. And I personally have been inspired by Inspired. So I pray, may Allah grant her Jannatul Firdaus. May we emulate her example, inshallah. Thank you very much.
Assalamu alaikum wa rahmatullah wa barakatuh. First of all, I want to thank Fatou and her team, and I want to tell you that you are friends. You could have simply forgotten Sainey, and it's gone 1 year ago. For all of you who have found time to come here today, I am very pleased because this was a very short notice. You were given very short notice, but with all that, a lot of people came. Leave your busy schedules to come here, all in the name of Sainey. Today, I can say I'm very proud of Sainey. I had never known how she was instrumental. But today, from today, Sainey, my star, like she is yours. And the family is here. Sainey, the little Sainey, Sana is here, and the twin brother is here. The mother is here. You came to the compound so many times, you didn't find me, but they are there. And each time you are welcome to come and see them. And once again, thank you very much from the bottom of our heart, and that we are very pleased with you, that you have found time not to forget Sainey, and we will not also forget you. All right? Jërëjëf jëf ñëpp fii mënoon naa bañ a fees na because foog naa ñaari ñetti fan notice lañ am waaye nit ñi bàyyi seen soxla yi ñëw fi tey all in the name of Sainey. Things I never knew, right? But ku nekk li nga bàyyi moo la topp. Okay? Your footprints is what follows you. Sainey ñu ko ñaanal yal na ko yàlla xare ajal. Jërëjëf.
Oh, okay. Okay. Jërë ngeen jëf. I just thank you everyone and thank you Mr. Ceesay. Papa jërëjëf yaa booy jërë ngeen jëf ak ñëpp ñu bàyyi si comme papa nu mu ko waxee ñëw fii join ñu tey gis nga ñu nekkoon online dañ leen waxoon ne su présentation yi yëpp jeexee ñoom mun nañoo dem waaye ñoom yëpp ñu ngi toog online ba léegi kenn ki mu ngi just message su dul loolu duñ dama waxaani ñu bari xariti seen yu bari ñu ma doon call di leen invite képp ku nekk am na leena loo ma dee wax almost ne dëji seeni bi métti na métti boo xam ne ñoom yëpp ku nekk def maa ne dama ko tegee boor pour bu ma ko bu mu nekk suma xel munuma koo génnee suma xel waaye xaw ma naka lay jooyee seeni so ñun tey fii moo tax ñu ngee bàyyi nit ñi ñuy jooy place la pour jooy waaye place la tamit pour kontaan liggéeyam parce que ñun yëpp lii la ñoo ñaan ñun yëpp lii la ñoo ñaan so again maa ngi jégalu wante ngeen baalal ñu waaye foog naa ne dafa necessary woon pour ñu dajee so again maa ngi waxaat ñëpp suñ commitment bi ñun yëpp nañ xool naka lañ mun a continuer.
asalaamaaleykum yéen ñëpp maa leen di nuyu si li ngeen fi teew yéen ñëpp di nuyu papa ak anti Njee di wax ne dañ kontaan tey macha allah si suñ cousin bi nga xamante ne muy Sainey Sainey moom bettuñu parce que ndawam daf ñu ko won ci jub ak rafet jikko ak yaatu ak ànd ñëpp macha allah foog naa ne Sainey sooy wax si moom dafa mel ni soxlawuloo dara parce que lim jox sa xel bi ak lim dund ak yow di nuyu suma nijaay macha allah dem tëdd noppaleku ndax yàlla daf ko fi indi woon pour mission ndax kenn ku ci nekk rek am na loola yàlla indi ba ñuy ñaan yàlla na suuf woyof ci kawam Sainey nag kontaan nañ tey si moom parce que kenn ko wax si Sainey si sa xol ngay tibbi ndax Sainey suñ Sainey ñun ñëpp la amul bokka ndey ak baay amul ñoo bokka suñ yaay yi ñoo bokka nii ak nii Sainey dafa wane ne man dama généralise ñëpp man ak ñoom la kon Sainey alhamdulilahi rabbil alamin di leen wax ne anti Njee ak papa am ngeen koo xamante ne macha allah tuba fakal dangeen ko bokk ak woon ñëpp te xamu leen tey nag xam ngeen kan mooy Sainey Ceesay jërë ngeen jëf.
waaw si closing bi dañ am ribbon buñ bëggoon a dog. ñu dem
Okay. Well, jërë ngeen jëf léegi ñu ngi come to closing pour cérémonie bi waaye comme nuñ ko waxee rek ñu ngi register ñu ngi jël number si ñëpp waaye man maa ngi am contact ak Yaaboy ak papa ak ñoom Oli ak Sali tamit ñu xool privately naka la ñoo working together waaw jërë ngeen jëf thank you everyone.